Today we are showing Ascelra. This is polydocanol, and we use this for medium to small spider veins. We can also use this for reticular veins. So she has some deeper reticular veins here, and she has some spider veins. So we're going to be treating both of those. And the neat thing about Ascelra, it's polydocanol, it's a detergent, so it's really not painful. If anyone has had prior treatment, and our patient has had prior treatment with saline, and it can be miserable, it can ulcerate, it's really painful, and feel free to tell us about your experience.
It burns really bad.
It burns, yes.
What a pleasant experience.
And it can ulcerate, which is never fun. So I've been telling her about, Ascelra was FDA approved in 2010, it's phenomenal, we love this, it's a really good tool. She'll like this. So we're going to start with this, and I love watching this. It's so much fun because you're just going to watch this vessel disappear. So let's start here. So that's a beautiful vessel. We're going to start right there. So let's start here. Tiny little poke. Teeny poke. Ouch. Very good. So you see that vessel disappear. Now we're going to come up and do this one. It's a tiny little poke. There it goes. That's it. So now those two have been treated. And then I'm just going to keep my finger here and kind of work, since this is a whole network. I'm going to work on this one too. So yeah, what do you think about the pain? Isn't that amazing?
Yeah, I can't feel anything. It was just a little prick.
Yeah, tiny little poke.
Slight.
1, 2, 3, ouch. Slight poke. There it goes. Poof. And just keep a finger on that. She is going to wear a support hose for the next. I prefer, we say 48 to 72 hours, 2 to 3 days. We like a support hose of 20 to 30 is optimum, but if they have 15 to 20, that's fine too. Oof. There we go. That's been treated. Okay, and then let's get this one. That looks like a good one right there. Tiny poke. You can see it kind of looks like it's bubbling through the vein. There it goes. So this whole thing, you see the bubbles up there? Isn't that amazing? So that's the circle above the circle that I'm treating. I'm just kind of, as you rub it, you can watch these vessels as they communicate. So this whole area has been treated. Oh, and I'm watching this too. So even though I didn't inject up here, we're still getting product all the way up here because everything here is communicating. That looks amazing. So now I'm going to go after these. Let's clean this up. Tiny little poke. Ouch. Very good. And now I'm going to come back with product that isn't foamed, and we're going to do these little vessels. That is really fun to watch as well. Here we go. Tiny poke. Poof.
That's beautiful.
Mm-hmm. It is really fun to watch. This is one of our most favorite things to do. And I'm going to go way up here. Tiny little poke, 1, 2, poke, ouch. She did have some Ascelra in this, I just want to make sure.
Based on what I'm seeing back here, I think you're going to be pretty happy.
Mm-hmm. I think so too. Tiny poke. Ouch. Doing okay?
Mm-hmm.
Fantastic. Mm-hmm. Good. Good. That looks really good. And then she has a couple of spots here. Tiny poke. Ouch. Poof. It is really fun to watch them disappear. Tiny poke in here. 1, 2, 3. Ouch. That one's gone. Beautiful. Mm-hmm. Excellent. Yeah. So it does kind of look hivey, kind of urticarial. That's typical for the mechanism of action of the Ascelra. It just stimulates her immune system to degrade all these little vessels. And yeah, that does look good. See if I'm able to get anything up here. A little bit, since we have a little bit left. Let's go up here. Very good. Super.
Yay.
Yes, I think you'll be happy. Fantastic. I think she's going to have a great result.